And I am the Board of Trustees Chair of the Alcohol, Drug, and Mental Health Board of Franklin County, or ADAMH as we like to call it. I'd like to thank Lori and the Stonewall Columbus for inviting us to be here and to be a part of this special day of recognition. As a member of the LGBT community myself, I'm particularly honored to be included in this evening's program. And I thank all of you for your presence here this evening. We're all here because of the tremendous value that we place on our children and youth in this community. Let me give you some brief context through the lens of ADAMH. Children and youth across all sexual and gender identities are struggling. 1 in 4 to 5 children and youth in the United States experiences a serious diagnosable mental health or addiction challenge. In fact, nearly half of all 13 to 18-year-olds experience some level of mental health disorder over their lifetime. Perhaps most disturbingly, children and youth are one of the most at-risk age groups for suicide. Nationally, suicide is the 3rd leading cause of death across all youth ages 10 to 14, and the 2nd leading cause of death across youth and young people ages 15 to 24. More teenagers and young adults die from suicide than from cancer, heart disease, AIDS, birth defects, strokes, pneumonia, influenza, and chronic lung disease combined. In a typical high school classroom, it's likely that 3 students, 1 boy, 2 girls, have made a suicide attempt in the past year. These are just truly frightening statistics. Sadly, suicidality disproportionately affects our LGBTQ young people. Research has found that lesbian, gay, and bisexual youth are more likely than their heterosexual peers to be bullied and are more than twice as likely to attempt suicide. These numbers only increase among transgender youth and youth with multi-marginalized identities, such as LGBTQ youth of color. Unfortunately, critical support systems available to straight young people are often not available to LGBTQ young people. As a professor of social work at The Ohio State University, my professional hat, I've been privileged to collaborate on research with folks like Angie Wellman, Dr. Susan Salzberg, Dr. Teo Clyburn, to ask our young people how the Columbus and Ohio State communities can support their journeys into adulthood. What we've consistently learned in our conversations with youth and young adults is that bullying and discriminatory experiences reported in all of the national studies are very real and present here in Columbus. And our most recent research indicates that these experiences do not stop when or if a young person makes it through high school and into college. The impact of harassment and bullying on LGBTQ young people can mean long-term adverse consequences, such as lower academic success, higher rates of depression, and increased suicidal behavior. As human service professionals, as family members, as friends, we're working together to interrupt these patterns and experiences to find ways we can reach out and support our young people in need. We know that early detection and intervention is the most effective way to address challenges and prevent suicide. Ensuring that Franklin County youth receive appropriate and effective mental health care is a charge that the ADAMH system of care takes very seriously. Although many more youth may be in need of specialized mental health and addiction services, more than 10,000 youth and adolescents benefited from a mental health or substance abuse program in the ADAMH safety net of agencies this past year alone. As an ADAMH board member, I'm proud to say that Franklin County's board is one of the first ADAMH boards across the state to recognize the need for specialized treatment services for the LGBTQ community. I was extremely pleased to approve the funding allocations that provide staff to work at Stonewall that Carla was just speaking about. Since 2012, with ADAMH investments, visitors to Stonewall Columbus are able to see a clinician and talk to someone about their mental health concerns free of charge. As Carla noted, this service was designed to to help individuals who don't have insurance or the ability to pay for their services. Since the program's inception, the counseling team has been able to meet and exceed all of its benchmarks. And feedback from people who've participated in the counseling sessions have been overwhelmingly positive. I'd like to take a moment right now to recognize the hard work of the counseling team from North Central Mental Health Services in collaboration with Stonewall Columbus. We truly appreciate all of your hard work. Join me in thanking them, please. ADAMH is also proud to support, through its mini grant program, the LGBTQ Grief Support Group that assists individuals in the LGBT community who are dealing with the loss of a loved one. This group provides a safe, confidential, and respectful environment for LGBTQ people experiencing a loss to link with one another. These ADAMH-funded programs, coupled with many other supportive programs in our system of care, ensure that people of all ages get the help and support that they may need. Through treatment and recovery, support and services, people in our community do go on to lead healthy, productive lives. We want to be certain we're talking with our youth to make sure they don't see suicide as the solution, but instead think to seek treatment. Unfortunately, there's still a stigma associated with mental illness, and it is the most common reason people choose not to seek treatment or reach out when they're having suicidal thoughts. ADAMH is working to eliminate stigma as a barrier to accessing care. It's our hope that increasing awareness through gatherings such as tonight's will help our community's youth see that there is support available to help them navigate their unique journeys into adulthood. Again, we at ADAMH are grateful for the invitation to share this evening with all of you. As we remember LGBTQ youth lost to violence and suicide in our community and around the world, may we also remember that ADAMH and the Franklin County provider system can be a resource for youth in our community who may be in need of help. Thank you all for being here to honor our LGBTQ young people. Again, it is my privilege to be here with you this evening. Thank you.